Welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer DeSablo, your host for today's show. Franklin County Home Health Agency is your local nonprofit home health care and hospice organization that has been serving the towns of Franklin County since 1969. Through this monthly show, we bring you information about the agency's programs and services, as well as helpful tips to help you and your loved ones stay safe and healthy at home. On today's program, we'll be learning more about new and exciting things happening in Franklin County Home Health Agency in our community, and I have two guests with me from Franklin County Home Health to talk about that. Janet McCarthy, our Executive Director, and Bridget Horrigan-Rivette, our Board Chairperson. So thank you, Janet and Bridget, for being here again with me today to talk about Franklin County Home Health.
Happy to be here.
And I think I need to introduce our beautiful quilt behind us too.
Yes.
This quilt we'll talk about more in the program is a raffle quilt that Franklin County Home Health Agency is holding right now. The proceeds will help our efforts in Franklin County, and we'll be pulling the winner for this at our Blue Jean Ball, and we'll be talking about that more in this program as well. So again, thank you both for being here. And you've been on the show before, but if you could recap and tell us a little bit about your history at the agency, Janet.
Well, I have worked at Franklin County Home Health for just a little over 25 years. I celebrated my 25th anniversary last fall. I've been the director for 20 of those 25 years. And it's been a very, very fulfilling career, wonderful opportunity to work in our community, and I'm just so proud of the work that our organization does, and very, very happy to work with the people I work with.
Wonderful. And Bridget, how long have you been with Franklin County Home Health on the board?
Well, I was introduced, if you will, to the agency in 2007. My dad was under the care during his hospice stay with the agency, and I had the opportunity at that point to meet some of your colleagues and was totally impressed and captured my heart, really. And afterwards, I said to my mom and my husband, I said, you know, I would really be interested in getting involved more with the home health agency. I said, I'm not sure how, but I'd want to find out and figure out who to talk to. Within, I don't know, a couple weeks, I got this phone call one evening, and it was it was the board president at the time, and the board had some openings and was looking for new board members. And it was kind of comical because I kind of stopped her mid-script. I said, I'm glad you called. I am very interested in serving on the board. So that was 4 years ago, I believe, and I've been involved as a board member and on different committees, and have found it to be a very, very rewarding experience.
What a great way to give back, like you were looking for.
Absolutely,
Yeah.
absolutely.
So talk about that as the board president. When you are recruiting for our board, what do you look for, and who makes up our board of directors?
The board of directors is comprised of folks from different towns across Franklin County. We look for a diverse representation across towns with different skill sets to come in to complement our executive and management team. The terms are 3 years each, and you're eligible to serve 2 consecutive terms. And we do have a history, I believe, of board members, you know, retiring after the 2 terms and coming back because the agency, you know, really kind of captures your heart in many respects. So each year we have 2 or 3 openings, and we talk with current board members and different folks to see what towns need representation, what skills we need to augment to make sure we have that diversity.
Sure. And you also have a requirement of some of the folks being served somehow through home care, is that correct?
Yes, we expect, I believe, over half of our board members to have family experience with home health services. So.
Which isn't too hard to do in our community after years of caring for this community. We've touched a lot of lives. So
right.
Yeah, that's
right.
great. Talk a little bit about what you learned about home care since your tenure here as a board member that maybe you didn't know when you started.
Well, great question, because my understanding and knowledge about home health has been increased on 2 different levels. One is as a board member, and from a board member perspective, I guess the adjectives I would use is I now understand how integral home health is to our extended communities. I have an understanding of the vast reach of home health with just the diversity of the programs and services and the number of people's lives that we touch on any given day, month, year. And then personally, my husband is now a client of home health, and so we now have an understanding, you know, really up close and personal how home health can really enrich your lives when you have need.
That's great. Thank you for sharing. And Janet, talk about some more of the programs that are in place now and what the agency's goals are within those programs.
Well, this last year has been just a phenomenal year in terms of growing and changing. You can't pick up a newspaper these days without reading something about healthcare reform and the efforts to, reduce costs in the healthcare system, improve the outcomes, and improve the experience for people that are receiving healthcare services. And so Franklin County Home Health Agency has been very, very active with our other community partners to make sure that people in our community receive the very, very best care. So we have a lot of measurements that we've been able to look at, a lot of data, and we're working together to try to make sure that our care is consistent, whether you're in the hospital at Northwestern Medical Center or you are at one of the local nursing homes or you are diagnosed with a new condition in the primary care office. We're really looking at developing systems, patient education tools, and common practices so that we achieve really positive outcomes. So we've, at Franklin County Home Health, we have been looking very, very hard at ways to reduce rehospitalization. Someone goes into the hospital, sometimes they come home and they're not quite ready to be home, so they take a return trip. Or maybe they've been home for a couple weeks, but they're still not quite fine-tuned, and they end up being rehospitalized. So we're been piloting a couple programs over the summertime. One is called Better Breathing, and it's to help individuals in our community with that have pulmonary disease, so COPD or emphysema, really learn how to manage their disease and prevent those rehospitalizations. And this week we'll be starting a second pilot project called Hearts at Home to help individuals in our community with heart failure to be able to avoid hospitalizations, avoid emergency department utilization. Those are expensive ways to receive care. Absolutely a place in our system, but there probably are some ways that we can avoid some of those visits.
More prevention and going forward. And
so we've been working with staff, training staff, using some technology to really be able to deliver those services to
And
make
these
a
are
difference.
for current clients?
So for current clients, and we anticipate that we'll have some future clients.
Yeah, sure. Yeah. So again, Better Breathing.
Better Breathing.
Hearts at Home?
Hearts at Home.
That's great. It's
So-
good news. And with those, are you working with those care partners as well in these new pilot programs? or is this-
We absolutely are. I think healthcare really does take a team approach, and it's not just a team within our organization. I think I've seen a lot of changes in my many years in healthcare, but I've never seen any greater change than the amount of collaboration and cooperation that I'm seeing in our community between all the different providers of healthcare.
Like you said, none of us stand alone, and there's a place for
Absolutely.
each one working together. Wonderful. Let's talk a little bit about our services and how an individual is referred, how we find the care, and then who pays for those services.
So people come into our care in a variety of ways. Oftentimes there's a patient is in the doctor's office and says, I'm really starting to feel like I need some help at home. Or the doctor says, you have a new diagnosis of diabetes and I'd like home health to come in to help teach you how to take your insulin and how to measure your blood sugar and how to eat properly. And so that's oftentimes, so we'll receive a referral from a physician's office. Sometimes patients are in the hospital. They've had an event, they've had surgery, they have a new diagnosis. And so the hospital's care coordinators make a referral to our services. We have a nurse that goes over to Northwestern Medical Center every day and meets with patients that will be coming home. And we have another nurse also down at UVM Medical Center for those patients in our community that might be in the hospital down there.
So they can meet them right at the hospital, answer questions, start setting up some basic
It's a
beginning
really
care.
good way to start that communication process. Those nurses give us a heads up. Somebody is coming home from the hospital on Friday and they're going to need this and that. And
Great.
so
And
it's a good way to start the relationship off with good communication.
And of course, individuals can call and ask or
Absolutely.
self-refer.
Yeah, absolutely. We We started our agency as a Medicare certified home health agency and then added hospice services, and through the years we've added a number of other programs and services that aren't all skilled. And Choices for Care is a Medicaid program for those individuals in our community that meet the nursing home eligibility criteria, and so oftentimes we'll get referrals from those people as well.
Great. So Medicare and Medicaid make up the majority of our funding then. How else, or what's the gap why do we do fundraising?
So Medicare and Medicaid represent about 90% of our funding, and as anybody who's read the paper lately knows that those continue to be cut back year after year after year. We also accept commercial insurances, Blue Cross Blue Shield, MVP, Cigna, but we have still a gap in our community for individuals who don't have insurance or are not eligible for Medicaid. So we have fundraising events like this. Our Blue Jean Ball helps to support those patients in our community to receive care regardless of their ability to pay.
We will be there, sure. So talk some more about, other than our fundraising events, we'll get into that, but more ways that the community as a whole supports our efforts.
So we are also belong or participate in the Franklin Grand Isle United Way, which has been very, very helpful. They're just about ready to kick off their 2016 campaign, and we certainly wish them well and want to do everything we can to support their success. The community helps us in a variety of ways through volunteers like Bridget. Our hospice program has about 45 volunteers who do all kinds of things: patient visiting, supporting families, support families during bereavement. They help with our Blue Jean Ball, and many of them have been taking our quilt around to different venues to sell quilt raffle tickets. So we volunteers are very, very important.
And there's a training for volunteers as well.
We have a training. We usually run it twice a year. Once be coming up in November, and the second time in the spring for people that might be interested. And
through that they'll learn all about hospice and how to care for families at the end of life, and they can call us to find out more information how to volunteer.
Absolutely.
Great. So,
but there's another key funding though mechanism that all the towns participate in, and that's the annual town funding that comes through during the town meeting process or the annual budgeting process. Last year, is it 17 towns in the county?
All 15.
15 towns in Franklin County allocated some of their monies towards supporting home health. So that is also considered to be a wonderful source of support, very critical from a financial perspective.
Yeah, we appreciate that. Very good. And individuals, how does an individual who wants to give back to Franklin County Home Health do so?
Well, individuals can do it in a variety of ways. Volunteering, we are very, very appreciative of the donations that we receive from members in our community through a memorial gift or an honorarium gift. This year, our board of directors established the Rug Johnson Fund. It was named in recognition of two of our four mothers, I guess. And Cynthia Rugg is a member of our community who's been very, very supportive throughout the years, and she saw a need in our community and wanted to also give back and support our staff. So the Rug Johnson funds are used or will be used to support staff development, training, certifications, any ways that we can help to support the people who really provide the care.
Right.
So to recruit qualified and to keep them there to maintain it. That's great. And then a way that people can be reminded of that Rug Johnson Fund, we do an annual appeal every year, and there is an option on the envelope for that and for other ways to designate their dollars. But like you said, memorial gifts and honorarium gifts are a wonderful way to give back. Do you want to talk a little bit more about the events? And Bridget, if you want to talk about the Blue Jean Ball.
Sure. The Blue Jean Ball is an annual, our primary annual fundraiser that we have. It's the last Saturday in October, typically, and this year it is on October 24th. It's just a fun evening. It's typically sold out from a ticket perspective. We have a pretty diverse set of items in our silent auction. We have a live auction, there's dancing, and that's all the evening, as you referenced, that we will pull the winning ticket for the quilt. Each year there's been a quilt. I think each year that I've been associated with it, the quilt just seems to be more and more beautiful. So we'll do that ticket and just have fun. It's called the Blue Jean Ball, so it's rather informal, if you will. Each year there's a theme, so we try to plan the activities and the decor around that theme. This year is the Mardi Gras, which worked out absolutely perfectly because our board happened to be meeting on Fat Tuesday. So we were able to do our kickoff in Mardi Gras style with our board back in February. So far the tickets are going really well. It's, like I said, about a month out, and so if you're interested, you can buy your tickets online. I think you can get your quilt tickets online, or if you can't be there and you want to support it, that's available as well.
Yeah. So they can call. Like you said, it will sell out fast, but currently right now there's some seats available to call or go online and get your tickets.
Right.
Love to have you have tables of 8. You can bring a whole group. It'd be a lot of fun. Yeah. We should mention, since you mentioned the quilt again, who made this quilt. Janet, if you want to talk about the quilt and the construction.
Well, the mastermind behind the quilt is Denise Chase, one of our care attendants, nursing assistants, and her trusty assistant, Connie Lane. I helped out a little bit as well. But Denise and Connie were the ones that were responsible for selecting the design and actually selecting the fabrics, and they did just a phenomenal job.
Yeah.
And Bridget, you mentioned our silent and live auctions at the ball, and another popular thing in our county are the barn quilts. And I know we have one coming from yours truly. You are doing one? Or?
No, I think Fern is.
Oh, okay, Fern is,
yeah.
But we've got a few donations of barn quilts, and we even have one that matches this that will be in the live auction.
I haven't seen that one yet.
One of our staff members.
Oh, cool.
It matches one of the stars.
Nice.
So if you're out there looking for a barn quilt for the side of your house or your barn, the Blue Jean Ball is the place to be. There'll be 4 of them there at least.
Oh, neat.
Yeah, so that's wonderful. So let's talk about our staff some more. Janet, in the summer, we always celebrate staff milestones, years of service. You want to talk about this year and the milestones?
Well, we're not a big fancy building. We don't have a lot of fancy equipment. What's fancy about us is our staff. And we have 200 staff members, and 35 of them celebrated their service milestones in June. We recognize 5, 10, 15, 20, 30 years of service, and the group that was recognized this year had a combined total of 435 years of service to our organization. So it's just really phenomenal. Many of our staff say, gee, I never thought I would work for any organization for 20 years or 25. So it's just, I think, a testament to the commitment to the work that that we do, the opportunity to get to meet and become acquainted and establish relationships with the people we take care of. It's very, very meaningful work.
So what keeps people there that long, Janet? Talk about what is it that we offer that...
I think it's the people. I think, we first of all, I think we have a tremendously caring staff. And so, when you work with colleagues that you like to work with, you want to stay working with them. Right. Our patients are just phenomenal. There's lots of opportunities to learn and grow. We're keeping up with technology. Our staff can enjoy a flexible work schedule, which is can't always find when you're working in healthcare in an institution or a facility. So I think those are some of the things. Home health care has changed dramatically over the last 10 years. When I started, it was kind of the place where you went and maybe you wanted to have a little bit more of a relaxed work style. That's not the case anymore. We take care of some very, very sick people, people who 10 or 15 years ago would have stayed in the hospital. So it's a great place to learn, a great place to sharpen skills, learn new things all the time, and it's just a great team.
Yeah, and as I understand, we help support people going to school, like you said, to learn new skills. There are quite a number of folks currently learning new skills.
We have 7 people that right now are going on to get their college degrees. We've got 3 LPNs who are becoming our registered nurses, and we've got a couple of physical therapists that are getting their master's degrees and healthcare administration. It's just really phenomenal to see.
Yeah, and I have to tell you, as a my husband being a client, that Jerry and I have been so impressed with the caliber of the staff that have come into our home, and we've seen a lot of different folks, a broad spectrum of capabilities and expertise that have come in. And as we meet a new member of the staff, Jerry and I have consistently commented on how impressed we are with their effort, with how they care. And the other thing I think that is a big part of it is they come regardless of the weather. I mean, we're out in Fairfield. We're at the end of a dead-end road. Most people think if you go over Fairfield Hill, like, you don't know where you are going to end up. And if we have an appointment, the person is there, and whether it's the dead of winter or whenever. So we've been very, very impressed and are extremely grateful. Extremely grateful.
Can you talk a little bit about being a patient at home and how that's been?
Our goal has been to keep Jerry home. We did a lot of work when we remodeled and built our house to plan for how he might progress. And home health has been an integral part of making that happen. Being able to come and bring a service to Jerry versus me having to get him out or him having to go through the effort of getting out, it's made a difference of being able to do it.
Yeah, it's wonderful. Yeah.
I think one of our goals in home health is always to have the patient be the center of care. And having been a hospital nurse many years ago, you sometimes forget about that. You've got a schedule to stick to, you've got meds that need to be sent out, the laundry's being picked up. But I think one of the things that's very different about working in a home setting is the patient really is the boss. The family is really the boss. And so we work really hard to try to engage patients and their families and into the care plan and making sure that they have options and understand their options. So it's really a privilege to be able to provide that kind of health care.
In home. Now, other than providing this direct patient care in homes, we do things in the community. Can you talk about some of the outreach that we do in our community and type of care?
Well, just coming up, we will be doing our flu clinics, our public flu clinics, and we strongly encourage people in our community to get a flu shot. I know last year was maybe perhaps not quite as successful with the vaccine, but nevertheless, the influenza can cause significant complications for people who are at risk, elderly people, people who are, immunocompromised or their resistance is down, if you will. So we will be starting those clinics coming up in October, and we really promote that wherever you get your flu shot, in the local drugstore or the doctor's office or our clinic. It's just really important. We also do foot clinics. Those are very, very popular. Gives a opportunity for a registered nurse to provide care to individuals who can no longer usually care for their feet. Feet are important, and so we do a lot of those. We do a lot of those kinds of things.
And quickly about, I always want to mention Start the Conversation. Talk about that program.
So Start the Conversation is an initiative that we started about 2 years ago, involving helping people to plan advanced directives or plan for the kind of care that they would like to receive towards the end of life, or if there was a quick decision that needed to be made, to make sure that their wishes are known throughout. So we've been very, very involved with that, and we're going to be picking that back up again this winter, and really encouraging our community to think about that and be comfortable with that, what can sometimes be a difficult conversation.
Sure. So we're getting close to the end of our time today, and I've just appreciated talking with both of you and sharing your personal stories, and wonder if there's something you'd like to add that maybe we didn't touch yet. You're welcome to.
Well, I just would like to take this opportunity to say thanks to our community for all your support through all these years. Since 1969, we were just an itty-bitty, teeny-tiny little agency to the agency that we've grown to come. We would not be successful without the support of our community through referrals, making a choice to have us serve families through donations, sponsorships of our events, these kinds of things, and also to our fabulous staff who just are out there 365 days a year.
Absolutely.
Rain, snow, sleet, big mountains, little mountains. They're out there making sure that people can get the care they need at home.
Great.
And the only thing I would add is, if I look at how many people we touch in any given year, and you start to multiply it over since 1969, right, or start to add it up, it's hard to think of folks that haven't been touched and helped by home health. But home health continues to evolve, continues to change. So if your experience with home health was a few years ago, get back in touch. It moves forward, it progresses, the services evolve over time. So, get back in touch in some way, shape, or form.
And like you said, so many people, it may be childbirth education, it may be a time with your child, that as we progress through our lives, there's different needs that home health seems to be there at every corner, so that's good. Thank you. And so thank you again for sharing, ladies, and thank you for watching. And if you have any questions about Franklin County Home Health Agency, its programs and services, you can check us out online at fchha.org. You can like us on Facebook and stay up to date on all our latest news and happenings. And we encourage you to make a donation if you are willing. We have online donations, secure and easy to do, or you can call our office or mail a donation in. We appreciate everything that you can do. Again, thank you for watching, and stay tuned for more information in our community about our Blue Jean Ball. Again, it's on October 24th. You can call us or go online for tickets or more information. Thank you. Have a good day and be well.